From humble beginnings as a Toyota dealership in Commissioner Street, Johannesburg, Imperial is now one of the continent's leading multinationals. With similarly modest beginnings, the logistics business was founded in 1975 and has since evolved into one of Africa's leading outsourced supply chain management and logistic companies. With expansive operations throughout Europe and Africa, Imperial works alongside blue-chip clients in almost every industry, partnering with them in unlocking the competitive advantage contained in their complex and dynamic supply chains.
Imperial Group is listed on the Johannesburg Stock Exchange. It is a business that is focused on outsourcing, either in the automotive retail environment or in the logistics outsourcing services market, and has existed for the last 40 years.
Since it began distributing pharmaceuticals outside of South Africa just over 10 years ago, Imperial Logistics has successfully influenced the way pharmaceuticals are sold and delivered on the African continent, tackling the problems of erratic supply, inadequate quality standards, and unreliable pricing information. Weak links in the healthcare supply chain can have dire consequences, including restricting access to drugs needed to prevent and treat AIDS, malaria, TB, and other deadly diseases. It is for this reason that Imperial Health Sciences is run as a healthcare organization as much as a logistics company. The aim of the healthcare business is essentially to shorten the supply chain, bringing the manufacturer closer to the consumer and resulting in more affordable and accessible healthcare. Lowering the price point of medicines also benefits manufacturers and distributors by growing the overall market.
So our logistics business, or our outsourcing services business, focuses on logistics services specifically in South Africa, but our growth into the rest of Africa has extended that into what we call end-to-end route-to-market solutions, where we actually help brand owners to take their product to the consumers in Africa. We believe that that is the next frontier, that is where the big needs are, and therefore where we can play a role to get products, like pharmaceutical products, to people who need those products. And Africa, as a billion people market and a growing economically developing market, has a huge need on the one side for healthcare, but also a huge demand for healthcare, which we can then be part of servicing, and therefore we see that as a critical part of our growth.
The acquisition of a majority stake in companies like RTT Medical, EcoHealth, and Dutch pharmaceutical wholesaler Emirates represents a carefully crafted plan that has come together for Imperial Logistics. It has placed the group in the unrivaled position of being able to offer pharmaceutical sourcing and delivery capabilities into and within Africa, down to the last mile. The result is a more secure and reliable sustainable supply of affordable, quality medicines for the people of Africa.
Really what we're doing there is creating a network across the different regional clusters of Africa that can service both all the sectors within the pharmaceutical healthcare environment, and whether that is ethical drugs or generic drugs or even other consumer-related products that are closely aligned with pharmaceuticals.
The whole thing is about partner development. It's about finding guys in country who want to grow their business and working with them and leveraging their efforts. So this approach we have of partner leverage acquire says it's not just we go in and we acquire businesses. Sometimes we go in and we find people and we just partner with them. We help them to build their business. Sometimes we go in and we find partners and we leverage the assets that they have in order to be able to grow our reach into the space. And sometimes we go in and make acquisitions. So it depends what the need is, it depends where we're at in terms of the market development, and it depends what the maturity of the partners in the country is as well.
According to IMS Health, by 2016, pharmaceutical spending in Africa is expected to reach $30 billion. This value is driven by a 10.6% compound annual growth rate through 2016, spurred by a convergence of demographic changes, increased wealth and investment, and a rising demand for drugs to treat chronic diseases. This market potentially represents a $45 billion opportunity by 2020. With demand for pharmaceuticals expected to increase dramatically, Imperial has made the necessary provisions to keep up with the demand and has established itself as a leading force in African healthcare supply chain management.
This thing's become a big player in terms of the delivery of pharmaceuticals across the continent. We process in excess of 120,000 orders a month throughout the businesses. That's going to hospitals, doctors, nurses, clinics, pharmacies, state institutions, distributors, sub-distributors. And we're doing that across 26 countries. But we're also doing 27 million patient packs of medicine every month. Now, that's a massive number of people who are actually getting affordable, quality medicines in a safe and secure supply structure. 27 million patient packs a month. That's a really, really important part of the healthcare delivery system of the continent.
Imperial has the advantage of being able to leverage off the group's already established network, together with their extensive experience in all channels, namely wholesalers, private and public healthcare sectors, doctors, pharmacies, hospitals, and FMCG, which means they can offer their clients the trust and confidence that is key to success in the healthcare sector.
So I think our company, we are really excited to being part of the African growth, because being in healthcare, you also support the overall local growth. Having people healthy, being part of families and communities, not only the relationship between individuals, but also being active in active workers, contributing to the growth of the local economies and the local communities, is such an important factor for health, and that's what we're trying to do. One thing we realized early in our Africa growth project was that we know what our core capabilities are, and that is our medications, support to doctors, support to patients, but we also recognize that Africa is a vast continent, and in order to ensure that our products are available to patients, we need to have the right partners. And one of these partners is, of course, Imperial. Without Imperial, we can't deliver on our commitment to our patients, that is, to have our medications available for them at any given point in time.
As a healthcare company, we are really committed to making sure that we provide access to our products, especially on the African continent. Partnership we have with Imperial is really, really critical. We have an Africa 2020 strategy whose objective is to increase access to 80% of the products in the continent. Now, access is actually limited by one of the major issues, which is the supply chain. And IHS, Imperial Health Sciences, really provides a pivotal contributor to ensuring that our products reach our patients in the most dire circumstances.
Imperial Logistics has a unique strategy in place which is designed around their clients' need for growth and expansion into Africa, at the same time minimizing their risk to the continent's complexities.
We'll believe that the job is done in what we are doing in healthcare when a client, a manufacturer of pharmaceuticals who wants to come to the African market can come to one organization, and no matter what they need as a business model in whichever country it is they wish to access, we will be able to answer that requirement. So whether they just need a get me there, whether they need a sell my product, or whether they need a build my brand in one market today or tomorrow in a different market the next day, they need a one partner solution. And that's what we've built with an Imperial. Our primary focus is getting pills to patients. We're about making sure that the drug companies that we serve and the patients to whom we're responsible get the products they need, and they get them in a safe and secure and reliable fashion. We use logistics processes to achieve that. We use the wherewithal of the greater Imperial Group around its warehousing and distribution capacity and its IT systems to achieve that. But our primary focus is health. It's about supporting the supply chain requirements and the supply chain changes that need to take place in order to get products more affordable for patients.
Apart from minimizing risk, the aim of this approach is to simplify business in Africa for their clients and offer a single source of engagement that can deliver world-class service, standards, governance, and control.
Whether you're GSK in South Africa or GSK in Kenya, you're still the same standards. Whether the patient is in Kampala or the patient's in Kisumu, the standards of quality and security are the same. And so it doesn't matter which market you're in, you have to drive the same performance metrics, you have to drive the same quality assurance. So we go into markets, and with a small business, relatively small business of healthcare, we're able to drive up the standards of our business partners in terms of their business practices, in terms of the way that they deliver service. Once we've achieved that, we can then bring behind that all the other products that come out of the Imperial catalog or the Imperial partners and clients' catalogs and drive those into the supply chains as well. So when we talk about healthcare as being the point of the spear, it's about using that standardization, it's about using that fundamental base that's not negotiable in order to be able to drive it.
At Imperial, each person's contribution is seen as vital in putting the product into the hands of the patient, and employees are made to feel that they do something that matters every day. In this way, a sense of pride and respect is inculcated, and they're willing to accept the level of discipline and accountability required.
There's no person in our organization that gets away with thinking they just do a job. Every person in this organization gets exposed to the fact that we are a part of the healthcare continuum. We're part of, what we do is get pills to people. We are there to make sure that when the clinical services are delivered, the pharmaceutical support is there as well. Because without that, the clinical services are not able to achieve their ultimate. And so we're part of a healthcare delivery mechanism. And we need our people to understand and respect the responsibility that brings. They're responsible for the safety and the quality and the efficacy of the medicines that we deliver. They're responsible for the outcome in the individual patient. And they can take great pride in what they achieve. We support the delivery of antiretrovirals to over 6 million patients on this continent. That's 6 million people who literally rely on us to provide them with the medication that keeps them alive. And so our people get that. Our people understand the role that they all have to play in making sure that works every single day. Something that our people have is, that most people don't ever get in their life, is they get a chance to do something that matters. And as an organization, it's what gets us out of bed in the morning. We get to do well out of doing good. We're doing something that actually changes the lives of the patients that we serve.